Hello everybody, I am really glad to be a part of Pediatric and Neonatology Conference in South Miami, Florida. Now I'm going to present today the role of gene replacement therapy in patients who have infantile and later onset spinal muscular atrophy. Now let me present myself first. My name is Dr. Ala Hamdan. I am Pediatric Resident at Sudan Medical Specialization Board and clinical researcher at Larkin Community Hospital. Now, let me talk a little about the role of gene replacement therapy and introduction about the spinal muscular atrophy. So, spinal muscular atrophy is an autosomal recessive and neurodegenerative disorder, and it's considered one of the most common genetic causes of infant mortality, as it affects 1 in 10,000 live births. Spinal muscular atrophy affects the alpha motor neuron that located on the ventral part of the spinal cord and the brainstem, which lead to progressive weakness and paralysis that become more prominent in the proximal part of the lower extremities. And the most devastating part, unfortunately, when the disease involves the pulpar nuclei and respiratory muscle, lead to respiratory muscle failure and death. In majority of cases with the spinal muscular atrophy, they present due to deletion of the major type 1 survival motor neuron gene that located in the long arm of the chromosome number 5. And as 95% of the patients, they present with heterozygous deletion of the type 1 survival motor neuron or due to gene conversion, and only about 5% of the patients present due to deletion of the same gene or due to missense mutation. The purpose of this article is to study the efficacy of different gene therapy that approved recently by the FDA in 2019. As all you know that there is no definitive cure or management to spinal muscular atrophy. So our main target is to improve the quality of life for those poor patients, as well as to modify maybe the natural history of the disease to decrease the mortality rate and the complications related to the disease. So our main clinical endpoint were the survival outcome, the functional outcome, the developmental milestone, and as well as the need for respiratory support, mechanical ventilation, safety, and toxicity profile related to each different gene therapy. It's a systematic review and meta-analysis that conducted according to BRISMA guideline using different keywords, and we ended up with a total 80 studies that were eligible for quantitative and qualitative analysis. By looking here to the first outcome, which is the mortality rate, as you can see, there was a significant difference that concluded by Finkel and Davos et al. Between the patient who received the nesinersen or the antisense oligonucleotide versus the patient who received onansimnogene. As you can see here, the mortality rate found to be 42% higher in the patient who received onansimnogene versus the patient who received the nesinersen. The other outcome, which is the pulmonary support or the survival outcome, as you can see here, there was no difference approved by the Finkel and Davos et al. For the survival outcome with relative ratio equal to 1.19. Also, the same result observed for the patient who needed permanent assisted ventilation with relative ratio equal to 1.34. By comparing this result to a Zaidi et al. Study in which 87% of the patients at the baseline did not require any mechanical ventilation or tracheostomy during the 2-year period of the study, and still 70% of the patients did not require any mechanical ventilation after introducing the gene therapy. But 30% of them developed acute respiratory failure immediately post-dosing, and that was mainly due to early onset of the disease, due to rapid progression of the disease, and the prognostic feature. So this side effect was mainly due to prognosis of the disease, but not due to the direct side effect of the gene therapy. In Mendel et al. Study in which the adenovirus-associated vector technique used to treat patients with the spinal muscular atrophy, and in this study there were two cohorts. Cohort 1 who received low dose of adenovirus treatment, while the other cohort received high dose of adenovirus treatment, and both of them, all participants were able to reach the age of 24 months without need for respiratory support. Other important outcome, which is the adverse event that related to the safety profile of the gene therapy, as you can see here, by comparing nusinersen versus the placebo, there was no difference between the incidence of the adverse events between the two groups, with the relative risk ratio equal to 0.96. But in regard to the severe adverse event, nusinersen found to be have a higher rate of severe adverse event equal to 37% when compared this to the patient in control group. Now again, by comparing this to Waldrop study in which there was 21 participants, 9 of them were infant less than 6 months, in which 7 of them developed non-worthy elevation in ALT, AST, and gamma-glutamyl transferase, while 12 participants were older than 6 months, and 8 of them had a greater liver impact, as they showed elevation in the liver enzyme 2 times higher than the upper limit. And 90% of the cases in this study developed asymptomatic drop in the platelet in the first week that recovered spontaneously without any intervention by day 14. In Chiriboga et al. Study in which concluded tolerability and safety of using intrathecal nusinersen with different concentrations that range from 1 milligram to 9 milligram. Adverse event of moderate severity only reported in 70% of cases, but there was no any other side effect that led to fatal outcome, to discontinuation or withdrawal from the study. And the most reported adverse events were headache in 39% of cases, post-lumbar headache in 21% of cases, and back pain in 70% of cases. In Biogen clinical trial, 81% of the patients who received high dose of nusinersen experienced a fetal outcome, as 25% of them developed acute respiratory failure, while 6% of them developed bradycardia. And by comparing this to patients who received 6 milligram of nusinersen, and that considered to be low dose according to Biogen clinical trial, 50% developed acute respiratory failure, while cardiac complications were similar between the two cohorts, and only one patient complained of a headache in the same group. In Mendel et al., in which the adenovirus-associated vector technique used for spinal muscular atrophy, actually 65% of serious side effects were reported in 30% of the cases, and 2 of these side effects were treatment-related grade 4 according to laboratory and common terminology criteria. Another important clinical endpoint, which is the functional outcome or change in the motor function. As you can see here in Waldrop study, 87% of the participants showed or had an objective improvement in the functional outcome by at least 1 point in the 4 months, and 70% of them demonstrated a 3-point improvement by 4 months. In a Zaidi et al. Study, 92% of cases were able to achieve full head control and sit without support for more than 5 seconds according to Bailey scale that used for toddler and infant development. 70% were able to crawl, pull to stand, stand to walk without support. In Chiriboga study, there was no significant change seen in the Hammersmith functional motor skill extended score for participants who received low dose of nusinersen. But By comparing this to the patient who received 9 milligram of the antisense oligonucleotide gene therapy, there was increase by mean of 3.1 point 3 months after the treatment, and there was also further increase in the long-term follow-up by 5.8 points. In Mendel et al., in which in cohort 1 study show increase by 7.7 points from the baseline, while cohort 2 study in which they received high dose of adenovirus gene therapy, there was increased by 24.6 points from the baseline. So, in conclusion, gene replacement therapy proved significant reduction in mortality rate that extended overall survival rate, improved the motor function, as well as increase in the children of Philadelphia and the Hammersmith functional motor skill extended score that uses milestone at the end of the clinical trial. And despite the fact that the nusinersen and onansimnogene technique reported asymptomatic thrombocytopenia and elevated liver enzyme that abrupt cure without intervention or taking only single dose of prednisolone, the toxicity benefit profile encouraged further long-term control trial in order to evaluate the actual efficacy and risk related